We get at the causes of why things happen, not just the symptoms of why they're happening. And if you can get to the causes, then people can combine their emotional well-being with their intellectual well-being. And I think that's the best way to solve any of these problems. If your mind creates the problem, then your mind should be able to heal the problem. And that's my philosophy.
Welcome to Harmonic Alignment, a podcast that explores the new frontier of energy medicine, bridging the gap between Western medicine and quantum physics, giving you easy and practical solutions. Guided by me, Dr. Larissa Sharipova, and me, Priscilla Koblenz. Join us on a journey discovering your harmonic alignment. Welcome to another episode of Harmonic Alignment, Hypnotherapy. Today, Dr. Larissa Sharipova sits down with Nick Colasanti. Nick has been practicing hypnotherapy since 1998 and has had over 1,000 client experiences. Nick discusses the amazing effectiveness of this wonderful healing modality.
I'm so very excited today to interview my friend and colleague and person who interviewed me on his radio shows before. Now we reverse our role. Welcome you, Nick Colasanti, who is a hypnotherapist, and we'll talk today all about hypnotherapy.
Hi, Larissa.
Nice to see you and nice to talk to you. So today I would like to ask you a few questions about hypnotherapy. How did you discover hypnotherapy for yourself?
When I started doing radio many years ago, 1995, I had a guest on my show. Her name was Shelley Stockwell, and she has a hypnotherapy practice in California. She has written a number of books since then, but I interviewed her. I was interested in what she had to say, and I asked her if she could teach me how to become a hypnotherapist. And she said, if you come to California, I will teach you how to do it. So that's how I got started. And since then, I have about 600 hours of training with different people throughout the years at different centers throughout the United States.
So you've been hypnotized yourself, and how did it work for you as a person?
It's interesting because in the beginning, it took me a little while to be hypnotized. And it was only because I think when you go to a class, I was trying to learn the technique. So I was not allowing myself to relax enough to move into it. But there was one time with my professor, my teacher, that just put me into a nice, beautiful state of relaxation. But I find with the people that I talk to, most people, I don't think I've ever had anyone who hasn't been hypnotized over the years. The big thing, Larissa, is that we have to establish as a therapist a sense of emotional safety with people, especially since in a practice like this, people already have misconceptions or they have doubts about what it is. So I spend a lot of time with people to build the relationship before we do any of the hypnosis itself.
For those unfamiliar, how would you define or describe hypnotherapy, and how does it differ from other form of therapy?
Traditional talk therapy deals with the cognitive side of our brain, the analytical side, the executive function side of the brain. And in hypnotherapy, we get at what we call the subconscious mind. There are two different words that people confuse: subconscious mind and unconscious mind. For us, the unconscious mind are all those functions of your body, like your breathing, your heart rate, your body temperature, those things that are controlled. We call them the autonomic nervous system, right? The subconscious mind is where all of your memories, your ideas, your thoughts, your feelings, your experiences are stored in your brain. Talk therapy works, but people have to go to it for many, many years at times. And when they come to see me, I say to them, tell me what's going on. They can give me chapter and verse and definition and labels of what's going on. I said, but how do you feel? They say, I don't feel any better. So they know their problem, but they don't feel any better. So I think a lot of times it's because we think that we can use our brain, the executive function brain, to try to make our emotions work the way we want to. And it doesn't work that way. That's why hypnosis is so powerful, because it gets at the emotional level, which drives most of our decisions, even though we think we're more analytical than that.
And our behaviors too. Sometimes we behave the way that we cannot explain why we behave, right? And that's what talk therapy. If you know that something is wrong with you, then you can fix it with talk therapy. But if you don't know why you're doing this or behave certain way, then talk therapy, I don't think would be very helpful in this regard.
And I think that's an important point. We get at the causes of why things happen, not just the symptoms of why they're happening. And if you can get to the causes, then people can combine their emotional well-being with their intellectual well-being. And I think that's the best way to solve any of these problems. If your mind creates the problem, then your mind should be able to heal the problem. And that's my philosophy.
That's correct. Yes. And we create a lot of problems with our minds.
Yeah, absolutely. Yeah. Perception. Whether perception is reality or not, perception is how we see reality.
So speaking about scientific kind of approach to hypnotherapy, can you describe scientifically how hypnosis works and what is happening in the brain during the hypnosis?
Yeah, maybe the best way I can explain this is to give people an analogy of how we see the brain that works. I don't know, Larissa, you probably know this, but before Windows was developed for computers, what was the operating system? Do you know?
Don't remember.
It was called DOS, DOS. And DOS just stands for Disk Operating System. It's very simple. So people think that when Windows was invented, that it took the place of DOS. But actually, all computers still operate on the DOS system, but the Windows, let's say, is a program on top of DOS, okay? So think of your brain as your executive function. The decisions you make every day are your Windows program. But what's driving the Windows program? Your DOS system. That's your subconscious mind.
Like a hardware, you would say?
I guess you can say it's like hardware, but it's more than hardware. It's software. The executive functions of your brain are like the software that makes the decisions. And then the DOS system is actually driving those decisions, although we don't know it because we think we're only acting on an executive function level, on an analytical level. So to get somebody to a place where we can get at that system, the DOS system, I'm just using it as an analogy. There's a technique that we use. It's called an induction, where you induce a level of relaxation within someone. And when they get to the level of relaxation, I can tell that by certain tests that we do, then they're open to a suggestion that would be healthy for them. They will reject any suggestions that are unhealthy, but their mind will allow them to take on suggestions that will be helpful for them. So I like to say that trauma happens from the outside in, but healing happens from the inside out. And that's why we use the techniques that we use to do this in hypnosis.
You mentioned some about misconception. So give us some examples and maybe demystify some misconception about hypnotherapy.
One of the big ones is today that many people have seen a show. It's called stage hypnosis. And you might be going on a cruise ship, or you might be like a lot of times hypnotists go to high school prom parties and all different places where the hypnotist, he talks or she talks to the audience. They bring people up on the stage. And it looks like those people their minds are being controlled by the hypnotist because they'll do strange things that they may not normally do in their regular life. So it makes it look like the hypnotist can actually control your mind. You can't do anything in hypnosis that goes against your will. So I think one of the misconceptions is that people lose control when they're hypnotized, when it's the exact opposite. A person could pop out of that relaxed state anytime they want to. I can't make them do something they don't want to do. And my whole approach is about therapy. I spend at least an hour talking to someone before we do the hypnosis piece so that I can find out exactly what's going on, and also that I can build a rapport and a relationship of safety with them. The biggest misconception is that people think they lose control when actually they have more control than they do in their normal life.
What can client expect during the hypnotherapy session?
Well, after we do the cognitive part, I call it cognitive hypnosis. That means that we talk about stuff, we do a little bit of the understanding, the talk stuff to find out what's going on. when the person's ready for hypnosis, I ask them, do you feel that you're comfortable enough with me to do hypnosis? And so they'll give me a yes, and then I'll say, any questions that you have, let me know. Otherwise, I'm going to help you think about what we're going to be doing. So then I teach them. I'm just going to basically sit next to them and talk to them with their eyes closed. It's not quite that simple, but it's pretty much like that. There's a technique that we use, as I said, it's called induction. And I use a technique called fractional relaxation, which means I take each body part and ask the individual to relax that body part, but not to judge it, just to give yourself permission to be as calm and as relaxed as you can be. And then throughout that part, Larissa, I'm testing. I can tell when somebody's moving into a state of relaxation. There's a thing we do called eye lock, where I ask the person to relax their eyelids so much so that they don't even want to work. And it's amazing. I had a young girl here last night who she just kept struggling to try to open her eyes, and she couldn't. And she's amazed by that, because she's aware and in a sense cognizant of what we're doing. But people take suggestions when they feel safe and when they feel relaxed. And it helps people move into that state of relaxation. When I think they're at a certain place, then I start giving them the suggestions for what we want to work on. It's called a pattern or a technique to move a person into the relaxation state.
And what's after that? So how do you finish the session?
Each session has the same form to move them into hypnosis, but during the session, it depends what we have talked about before we did the hypnosis as to what the suggestions are. After I've used the suggestions to help the person feel as comfortable, as relaxed as they can be, they take on the suggestion. I say, look, Larissa, this is your journey. You know you better than anybody else. When you're ready to come back, your eyelids will open. They won't be stuck shut anymore. You'll feel a deep sense of relaxation, and you come back when you want to. And so some people will take maybe 10, 15, 20 seconds. Some people like 2 or 3 minutes. They like being in that state of relaxation. Then all of a sudden their eyes open. They usually have a smile on their face, and it's a good thing. No matter what we've talked about, no matter how upset they were before, usually they come out of that feeling good with a lighter feeling about who they are.
Mm-hmm. And I remember my experience when I went to see you with my kids. Yes,
Okay.
It's very good and relaxing environment. Yes, and you feel happy after that deep relaxation.
Yeah, it's nice. I mean, see, you mentioned about working with children. That's one of my favorite things to do. I think I've told you before, I've worked with somebody as young as 2 years old. And I love working with kids because they have great imaginations. They take the suggestions and they use what you teach them. They don't have all the clutter that you and I do from being adults for a long time. Their minds are more open to this stuff. Again, but it's like anything else. You know this in your practice as well. You have to establish a sense of emotional safety, especially with kids, because they're suspicious too. They don't know me. I'm just a guy in their life that their mom or a friend or somebody brought to me. So you have to earn people's trust. I think that's an important part.
And I like if you give us that example with the 2-year-old to our listeners, how you can work, and maybe some other cases that you work with.
It was the first time I'd ever had somebody that young. I've worked with kids maybe 5 or 6 years old with emotional traumas, emotional problems, and I can identify what's going on with them because of experiences that they'll tell you about. The 2-year-older came to me with her mom and dad. Her mom called me and said, I've heard about you. My daughter's afraid to poop. She was afraid to go to the bathroom. And I said, well, have you seen the doctor? She said, yes. All the doctors keep telling us to do is giving her more laxatives. And we know that can't be good for her. You can't do a traditional induction on a 2-year-old because they don't understand any of that stuff. So what I thought about was I got a finger puppet, and I talked through the finger puppet to the little girl and told her it would be okay. She doesn't have to be afraid, and she can be okay now. And then she gave it a name, and then she related it. She told me that she has a friend who's a stuffed animal. I said, well, this little thing wants you to be okay, and it can be your friend just as well. And you don't have to worry about going to the bathroom anymore. So that's the core of it. The next day, the mother called me and said she was fine, that she was doing everything she could never do before. No medication, just a suggestion. It was a powerful thing for me too, because then I realized that I don't know exactly what takes place, but I know that it does help people on every age level.
And so you didn't even need to put her or baby in the hypnosis state because baby already very suggestible. Their conscious mind is not as like our language kind of not developed yet, right? So you didn't put her in the meditation hypnotic state.
No, not in the true sense. She's just sitting on her mom's lap and she was squirming, and she's a 2-year-old, beautiful little girl, but she was afraid, and it's because as adults we don't understand the mind of a child really. We've kind of forgotten that over the years, right? We only know where we are. We can say, well, geez, I remember being this, but it's hard to remember things that when you were that young. So I love working with kids of all ages. Teenagers are great too. They respond really well to this. You just have to get them to talk, Larissa. That's the hardest thing, is to get them to talk and communicate and be open. You know that in your own world.
Yeah, and I have 2 teenagers, and sometimes it's hard for them to communicate with their parents, but they are much easier to communicate with the stranger or some other person.
Absolutely. Yeah, because they don't feel that sense of judgment or having to prove themselves when they come to a stranger in a way. But it is important to establish emotional safety. I think you agree with that, right?
Yeah, yeah. So what's some most common issues or conditions that people seek hypnotherapy for, or maybe specifically like what you see in your practice?
Yeah. Well, in my particular practice, other therapists send people to me many times, like traditional therapists or doctors that haven't been able to get through or help the person on their level. They send to me. So I get a lot of issues surrounding anger. I get a lot of issues surrounding abuse. That was one of the hardest things for me to realize, that many people have been abused, and many as children, from parents, from friends, from brothers and sisters. I mean, it's always been very difficult for me with that, but people having difficulty expressing their feelings because maybe they grew up with somebody who was hypercritical of them, or, made them feel bad about everything that they did. So you have to kind of unwind a lot of that stuff to get people to feel that they're really okay. They can be okay. I always say this, and Larissa, maybe you remember this. I always ask them, where did you get your self-image? And they take a minute and they think about that, and they don't really have a true answer. I mean, where is our self-image from? It's the way we perceive that other people perceived us. And we started living by the perception that we thought they were giving us, because as a kid, we don't know much about that, right? So I keep telling people, what you're doing today, being hypercritical, being afraid, being all these things, you've been living a lie for a long time. You think you're this way, but you're actually this way. And I hope to show you that you can feel good about yourself. This young lady that came to see me last night, she's studying to be a dentist, and she had to take a test where now she's studying, Larissa, every day for 60 days, 8 hours a day, nonstop. She has to do that. And the anxiety is building about having to take that test, which would determine whether she can get into dental school or not. So she came out of that. She's as calm and as peaceful and as relaxed and as focused as she could be. I connected with an idea with her that she had a trauma when she was a kid. She fell and hit her head, a severe concussion. And so as a result of that, she's created a doubt within herself as to whether or not she's smart. She's incredibly smart, Larissa, but she didn't believe it. She's always wondering, well, would I have been different if this didn't happen to me? It's so interesting to me, Larissa. This work is so profound and so interesting to me. I just love doing it.
And I think when something happened in childhood, it's become like our tape, right, in our head, that's what create the suggestion, good or bad suggestion in our brain. And that's what your work, like unwind everything back or like erase the tape.
Yeah, you said it earlier, when people intellectually, they have an idea, but they can't tell me why they feel the way they do. And that's where that subconscious mind stores all of that information. Everything that anyone has ever experienced is stored in your brain. I've done things with people where I could regress them back to the moment when they first got up to walk and they could tell you what their parents' clothes they had on when they first stood up the first time as a baby. It's in there. Everything is in there. It's good that we don't retrieve all of it, because there's a lot of experiences that haven't been good for us, right? But it is a powerful tool to be able to connect with the things that hold us back from being the people we would like to be.
And sometimes it's a good for us when our brain is shut down, some horrible trauma that we experience, it's just to protect ourselves from that experience. And sometimes people get in the freeze response. That's why they numb, they don't have feelings, emotions, because that's a normal for our brain, unconscious brain, to protect us so we don't remember what's happened with us. When you work with people, do they always need to remember the cause of the issue or trauma, or they have to kind of dig out the traumatic experience? Do you do that?
Well, I say this to them: you may or may not remember the things that I say to you. But if you try to remember what I'm saying to you, then you're not going to be hypnotized. The person has to be able to suspend a little bit of judgment. And the goal of a session, especially the first one, because that's their first experience, is to get them to realize that they can be calm, that they can be relaxed. Because many times people say, I can't relax. I've got a lot of mind chatter. I don't sleep well at night. I hear that constantly with people. We live in a stressful world, Larissa. People have more stuff than they've ever had, but they also pay a bigger price for it than they've done emotionally. So it's that kind of thing that you have to work on with them. Some people remember, other people don't. But I say, if you try to remember, it's not going to help you, because now it's like I'm your professor. I say, I'm not your professor. I'm not your dad. I'm not your teacher. I'm not your spouse. I need you to not pay attention to me. I need you to pay attention to yourself for once, and just let yourself be as peaceful and as calm and as relaxed as you can be. And I'll do my best to help you get there.
Give us more examples of some interesting cases or specific impactful experiences that people had.
The most dramatic one that I've ever had was a young guy in his 30s who had taken his family to the shore, and he dived into the water. He didn't realize that it wasn't deep, and he hit his head on the bottom of the ocean floor. As a result of that, he was totally paralyzed, Larissa, from the chin, neck down. He was unable to move any parts of his body, and the doctors had told him that it would always be that way. He could communicate with you, but he couldn't do anything else. He had to have a 24 hours a day, somebody there, And so I met him through a friend of the guy's wife. This other lady had come to me. I helped her. She said, well, my girlfriend's husband had this happen. Do you think hypnosis could help him? And I said, I've never worked with a quadriplegic before. I have no idea. But if they're willing to try a session or two, let's see what happens. I don't want to make the story too long, but the first time I went to see him, he was in the hospital, and his wife came out to see me before I saw him. She said, I'm sorry, he's really out of it. They gave him some medication. He's not going to be able to hear anything that you say. So I said, well, look, I was I think maybe an hour and a half away. I drove here. Let me at least go meet him and maybe talk to him, even though seems to be, out of it in a way. So anyway, they were finding that when they would take him away from the hospital, go for another treatment, that when he came back, he was always super agitated from it emotionally. And they could never get him to calm down without giving him medication. So that time, even though he was totally non-responsive to me, didn't say a thing, he was just laying in bed, I decided to talk to him as if he could hear me. Larissa, the very next day, she called me. She said after he came back from the other hospital, he was as peaceful and as calm as could be. So that was the beginning of my believing that I don't know what goes on in a person's mind. We think somebody's unconscious. We think they're in a coma. And I've worked with people like that too. But anyway, then later on, I went to see him maybe 5 or 6 times, once a week for like 5 or 6 weeks. Before he passed away, I was able to get him to feed himself. Okay. And yet he wasn't able to move a muscle or anything before that. When you start having experiences like this, I know it's anecdotal, and I'm sure in your practice you've had experiences too. All we can do is tell people about it. They have to decide whether they can believe it or not. But I am a believer. I saw an 85-year-old lady in the hospital that I had seen before, and then she was taken to the hospital and was in a coma. They couldn't get her to respond to anything. There was a woman in there before me telling her that she could die if she wanted to. And I had remembered talking to this lady in one of my sessions before, and I said, well, do you want to die? She said, no, my kids want me to go, but I don't want to die. So when she was in the hospital, I said that to her. She was unconscious. She was lying there. And I said to her, you told me you don't want to die. You can come back. You don't have to stay in this state. And so she opened her eyes and she said, I like you, Nick. And I said, well, what do you want? She said, I want to do my nails. And that was fine. It was it.
Wow.
I mean, anybody seeing her, Larissa, she was in a coma. How did that happen? I don't know. It just shows you. So they're really powerful examples. I think it's important for us as practitioners to 100% believe in what we do, because somehow that transfers to the clients or the patients that we work with. If we don't believe what we're doing, how can they?
And also give them the power of belief, because if you tell them that you're gonna die in 6 months, that person gonna die in 6 months.
They do.
Suggestion in their brain and their unconscious mind. Same with like cancer diagnosis. Like, why you're not a God to give people the time of their death? Even God doesn't have that. I think it's all in our power. Like how long we wanna live. And if you give somebody a suggestion, that might happen because that person gonna start believing in that.
Especially when that suggestion is given by an authority figure, right? It's unbelievable to me how people with good intentions, I hate this term. There's a term called being brutally honest. I hate that. Those two words don't go together. They shouldn't fit together. They think they're doing you a favor by saying what they believe is going to happen to you. I can't tell the future, can you?
So yeah, be careful what you say next time.
Exactly.
Even as a parent and children, sometimes it's in our best intentions, tell kids maybe something that they wanna do, and it's be hurting them by saying them, and it's gonna stuck in their brain for the rest of their lives. So now, like, I even careful how do I communicate with my kids by knowing all that suggestion in our unconscious mind. So that's powerful.
Let me give you another thing that's really interesting. When people go in for surgery and they're put in anesthetic, they're knocked out, right?
Yeah.
I have done hypnosis with people that can tell me what the doctors were talking about while they were anesthetized. We have to be careful all the time. If somebody's knocked out, you think they don't hear, they don't understand. Our mind is always working, always. Our senses are always working, whether we're aware of it or not. So just think of how powerful the power of a doctor's and something they say during an operation, how that could be. Doctor could say, I've never seen a case this bad in my life. Okay. The patient may take that on and not heal as a result of what they said, instead of hearing the next part. But she's really getting better very quickly. If they missed the second part, only got the first part, the suggestion could stop them from healing.
Yeah, I heard a lot of stories that happened, what conversation in operating room or in other like anesthetized condition. Yeah.
I think what this has done for me over my life is made me become aware of how we affect each other. And the more powerful the relationship you have with someone, the greater the effect you can have on them. And it works both ways. Or if there's a position of authority, if we give that authoritative person credibility, there's a good chance we're going to take on what they, quote, suggest, right? And so we have to be aware of our language and how we communicate with each other and how we treat each other, because it makes the world of a difference in our lives.
What conditions or situation hypnotherapy is not recommended for?
Well, as I say, that if your mind creates it, then your mind can heal it. But if somebody comes to me and they have a severe mental issue, they maybe have seen a psychiatrist or whatever, after I talk to them, I know whether or not I can do anything to help them. But, I always tell people this. you will feel better after one session if it is for you. Now, that doesn't necessarily mean that it's going to fix the problem you came for. You will feel better about things when you leave. And that gives me an indication of whether or not they're going to be okay. Now, the other thing is many traditional hypnotherapists, they want to schedule multiple sessions at one time. Mm-hmm. I don't do that. I take one session at a time, see how the person does. I say, well, look, how do you feel? Would you like to come back? They'll tell me, yes, I'd like to come back. Rather than setting them up for 5 sessions and collecting the money before they even know whether it's going to be beneficial for them. I can't judge how the person's going to respond until afterwards. Why would I pretend as if they have to come for 5 sessions when they maybe only need 1?
And you said it can be helpful even from 1 session. Depends on the case, probably.
Right. It depends on what they're coming for. Many times phobias like fear of flying, fear of bridges, fear of, bugs, spiders, animals. Usually 1 session or 2 takes that stuff away completely.
Wow.
It's pretty amazing.
So what advice would you give someone considering hypnotherapy as a client?
Okay. I would say, I always tell this to everybody. First of all, I don't expect you to trust me blindly. I want to be able to earn your trust. And I say, look, if you're not sure, let's just do 1 session and see how you feel. You will know after 1 session whether this is for you or not. Most people will say yes to that. I mean, we spend money on things that will never come back to us, and we waste money like it's nothing, right? So to put some money into yourself and to help yourself feel better or give yourself a chance to feel better, to me, that's worth it. I would do that every day of my life if I knew I'm going to get some benefit from it, or at least I'm willing to find out whether I can benefit from something.
And I would say also the best way to find a hypnotherapist is by the referral, because there is so many different hypnotherapists out there.
Right.
I always recommend somebody who I know if I already had a session and experience. So that's the best way to find someone.
And that's exactly what I do. I don't really do any traditional advertising in that sense. Word of mouth, recommendations, referrals. That's how I get most of my clients. So
how can people find you?
I have a website. It's centerhypnosis.com. Just the word center. hypnosis.com. They can always email me at hypnosleep@aol.com, hypnosleep@aol.com. They can call my office, 610-326-8647, 610-326-8647. I don't charge for consultation. If somebody wants to talk to me on the phone or do a follow-up after something, I only charge for actual sessions.
Thank you, Nick. Thank you very much.
It's been my pleasure. Thank you so much for asking me to do this. I appreciate it.
We hope you enjoyed today's episode of Harmonic Alignment. If something resonated with you, we would love to hear about it. Please consider leaving us a 5-star review and subscribing so you don't miss an upcoming episode. Thank you. The information contained in this podcast is provided for informational purposes only and not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and directions. The products and information received through the podcast should not be used to replace a consultation or advice from your healthcare provider. If you suspect you have a medical problem or have any healthcare questions, please promptly call your healthcare provider. This podcast, including Dr. Larissa Sharapova and Priscilla Koblenz, and the producers are not responsible for any possible adverse effects from the use of information contained in this podcast. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct financial benefit to the product or services referenced.